Hello and welcome to 72 Dragons Health. Today, we have the pleasure of speaking with Mr. Albert Pless. Mr. Albert Pless is currently serving as the Director of the Office of Equity and Social Justice in the town of Reading, Massachusetts. In addition to his role as a Director of the Office of Equity and Social Justice, Mr. Albert Pless has also spent 2 years as Andover's Director of Diversity, Equity, and Inclusion, and 14 years as the Program Manager of the Men's Health League at the City of Cambridge Public Health Department. He has played a pivotal role in advocating for public health and exploring diverse perspectives in the diversity, equity, and inclusion field. Throughout his career, Mr. Albert Pless has led by example in showcasing his professional accomplishments as an Adjunct Professor for the MPH Program at Johnson & Wales University and a member of Boston Children's Hospital's Institutional Review Board. He has also been a part of the American Public Health Association, President of the organization's Black Caucus of Healthcare Workers. In addition, he's been the co-chair of the Harvard Catalyst Community Coalition for Equity in Research. Welcome to this interview, Mr. Albert Pless. We are honored to have you with us today.
Thank you. Glad to be here.
Mr. Pless, can you please provide us a brief introduction of your responsibility as the Chair Caucus Collaborative Representative and Governing Council Representative of the Men's Health Caucus at the American Public Health Association?
Of course, the role pretty much has the Men's Health Caucus have a seat at the table in regards to sharing perspectives focused on men's health. So APHA is a kind of layered and complex organization, but just for purpose of our conversation, every caucus has an opportunity to be at the seat of the governing table to share perspectives based upon their focus and their interests. And so men's health is the focus that we have. And so a lot of the sharing perspectives and policies and that are important to us.
Great. How do you leverage the opportunity of working as a program manager of the Men's Health League of the City of Cambridge Public Health Department to raise awareness about men's health concerns and equitable yet inclusive health care?
Yeah, it was a great opportunity to work at the health department in Cambridge. I was there for 14 years, and a lot of what I learned in that public health department space is that the importance of local public health, of partnerships, collaborations that can be built through public health, particularly in a city like Cambridge. And so, for me, prioritizing men's health, particularly the health of men of color, the way that we did that and the way that I built that throughout my career is through partnerships and collaborations. And so that's what I learned, that process in Cambridge. And I've used that throughout my career in regards to really partner with other organizations, other sectors to make sure that we prioritize the health of men of color.
Thank you. Can you let us know about the current projects you are working on as the Director of the Office of Equity and Social Justice in the town of Reading, Massachusetts?
That's my full-time job, which I'm really excited about, being there working for a local municipality in Reading, Massachusetts, population about 27,000. So this position is a position that works with all the different departments within the town of Reading, as well as different community-based organizations. And really the emphasis of the position is really to make sure that we're centering diversity, equity, inclusion throughout all policies, throughout really thinking about from a systemic lens as well, building community collaborations and capacity, to really do the work. And so a lot of it is really making sure that the most marginalized communities in Reading, that their voice is heard, to make sure that, again, we're doing that with that perspective around building partnerships and collaborations to make sure that that happens.
Now, what are the challenges you have faced while advocating for health and racial inequities throughout your career as a public health advocate?
I think the challenge is, well, one of the big challenges I think is really this finding the data to make the case. I think that we still have to collect the correct data. I think there's still a lot of mistrust within a lot of the communities that there's disparities with. And so really, I think there's distrust with sharing the data. So a lot of times you just don't really have the data to make the case, to get the grants, to support the work. And so I think, really beginning to still build trust with communities. It's why I really found myself on some of these boards around building the connection between community and research. It's really an important aspect for my work, because making sure that if we don't have community, particularly community representatives who have health disparities, if we don't have that trust built within research, it's going to have a hard time them, sharing data that reflects the broader community. And so that's why I really found one of the biggest challenges, really make sure we collect the data, we have the right data, we collect the data in a respectful way from community, and use that data to really inform our work going forward.
Yeah, data is definitely very important. Now, APH 80 is approaching. Can you tell us about any exciting event, presentation, or initiative for the Men's Health Caucus at this year's American Public Health Association annual meeting in Minneapolis, Minnesota?
Yeah, we're excited about being in Minneapolis. We have our excited program. I don't have it in front of me, but really, I think we're really highlighting the work of fatherhood, which is really one of the things that we really have been emphasizing a lot within our caucus, really to make sure that we're talking about and emphasize the importance of prioritizing fathers and research focused on fathers. We're excited about our focus and work on cancer, and so really we're excited about our program overall. And I think this is an opportunity when we go to APHA to really make sure that we are, which we still are one of the newest caucuses at the American Public Health Association, even though we are about 12 or 13 years old, really still making the case for men's health and why men's health matters to all of us. So really, we're excited about our overall program and the ability to collaborate with the partners when we get there.
Sounds exciting. Mr. Albert Pless, thank you for joining us today to discuss your experience and help us understand the importance of advocating for men's health concerns and inclusive healthcare from a diverse public health perspective. We wish you much success in the coming APHA 2024 and in all your future projects. Thank you very much.
Thank you for having me.